Hi, this is Dr. Tony Mork, author, speaker, endoscopic spine specialist. Today, I'd like to show you what an endoscopic interlaminar discectomy looks like and what the purpose of it is and what the benefits are. Although the interlaminar approach can be performed at multiple levels, probably the best level and the one that has the most difficult time with other approaches is the L5-S1 level with a disc herniation. Let me show you on this MRI. Here we have a L5-S1 disc protrusion, which is fairly good sized. These are typically difficult to approach from a transforaminal approach, and the alternate, which is I think superior, is the interlaminar approach, which I'm going to talk about today. This is the protrusion on the sagittal, and I will show you the protrusion on the axial. There's the protrusion of the L5-S1 disc on the axial slices ranging right along in here. Looking at the lumbar spine from the side, we can see L5 and sacral 1. If we go to the back, we can see between lumbar 5 and sacral 1 that there is a window. Now, this window is covered normally with the Ligamentum Flavum, and then, of course, the tissues over that, which include some mild muscular tissues and some fatty tissues, and then finally the skin. And when you put something down here, the first thing you bounce off of is the Ligamentum Flavum. So, in this particular case, the scope can be placed into the spinal canal without cutting any bone after cutting the Ligamentum Flavum, so just a soft tissue exposure. So as you can see, the tube that the scope goes through has a little bevel on it. So this is a pretty clever idea in that the tube with the bevel is initially placed like this, and then when the Ligamentum Flavum has been divided and the nerves can be visualized, the bevel is turned 180 degrees, so that now the nerve is pushed out of the way and retracted. This allows us to work on the disc without the nerve being in the way. Now I'd like to show you a short video of what it looks like to get into an L5-S1 disc space. I hope you enjoyed this presentation of doing an L5-S1 interlaminar approach using the Wolf endoscope for the least invasive approach to the L5-S1 disc. Thank you.